Good afternoon, everyone. Welcome to today's webinar. My name is Stephen Kolosi, and I am a Principal Ergonomist at the Construction Health and Safety New Zealand, or CHASNZ. For those who don't know who we are or what we're about, we are a charitable trust who work with industry, government, and the regulator to improve safety for the construction industry. If you want to know more about who we are, please visit chasnz.org.nz. Now, the purpose of these webinars is to showcase innovation that is happening within our industry and to learn different perspectives that help shape construction in New Zealand. Now, before we begin, I have a few housekeeping rules. Please, can we leave questions till the end of the presentations? And if you have a question, please feel free to pop it into the chat function or the Q&A function on Zoom. My wonderful colleague Anna will be moderating this space. So today's webinar is on the importance of sleep and injury prevention, and it's a topic that is very important to our industry. To speak more about this, we have a fantastic panel who will provide their perspectives on this area. Now, our panelists today consist of Dr. Kelly Dale from Healthy Lifestyle New Zealand, Matt Vaughan from Heal Me Well, and our very own Chris Polachik at CHASNZ. Panelists, if you could please unmute your mics and provide a brief introduction of yourselves, starting with Dr. Kelly.
Thanks, Steve. Kia ora, everyone. My name's Kelly. I have worked with organisations for well over a decade now, specifically in the area of sleep and fatigue management, and also in the areas of wellbeing. And so that's been all sorts of organisations and industries, so everything from farmers to shift workers, to healthcare, office-based workers, commercial drivers, and that's included everything from some research projects that we've had so that we can understand what does sleep look like in some of these different industries, what are some of the risks that are contributing to fatigue, and then some interventions to help us kind of get to these root causes and overcome these issues. I've started working with CHASNZ probably, I think, in about the past year, and there's really minimal kind of international research and local kind of research and knowledge around sleep and fatigue. And so, really excited to be here today and to contribute some insights. So, that's me.
Thanks, Kelly. Matt?
Yeah, hi everyone. My name's Matthew Vaughan. I run Heal Me Well and another business called MB Corporate Health. To give you a bit of a background on myself, I look after a lot of mainly blue collar businesses up and down New Zealand. Recently been affiliated with RAN, so I look after a lot of roofing companies. Also getting involved with a lot of joinery companies and also construction as well. Plus looking to get involved with scaffolding as well. But they all sit around that nice little niche that I look after. My background has been in the coaching industry for about 20 odd years now. First started in strength and conditioning, and then I moved into nutrition, and then I moved into mental health. So I like to think that I can help out in different ways, but I love to bring in expertise into specifics as well. So really looking forward to joining this and giving my expertise on this as well.
Thanks, Matt. And Chris?
Good, everybody. Chris Polachik. I'm the other half of the ergonomics team at CHASNZ, along with my good buddy there, Steve. We run the Work Should Not Hurt program, where sleep has become more and more a standout contributory factor towards musculoskeletal problems, and we'll talk to you about that a little bit more soon. So I'm really excited to be here with some great people, Matt and Kelly, who are helping us take this subject further in construction.
Right, thanks, Chris, and thank you, team. Right, so for our agenda today, we are going to talk a bit about the correlation between sleep and injuries, sleep hygiene for tradies, what employers can do, sleep pathologies, what employers and employees and employers can do. Chris will talk about an upcoming study with roofers, and finally we'll end with some questions and answers. So, right, without further ado, let's get started. Over to you, Chris.
Yeah, thanks, Steve. Well, I mean, I'd like to start by saying, give us a thumbs up in the chat, webinar people, if you rely on a good night's sleep to function at work the next day, because I sure do. And I think, you know, we do not doubt the importance of sleep because we live and breathe it and we need it. So give us just a quick naughty thumbs up in the chat if you're, if like me, you think that sleep is fundamental to function. So this whole project started when we were working with Kelly on the exoskeletons trial for the roofers. And we were so chuffed with the results of this short pilot trial of exoskeletons and the wonderful effect it had on the roofers' sleep. So we were able to measure with 24-hour heart rate monitoring that the roofers' sleep, both in time and quality, we've really benefited from wearing of the exoskeleton. But then Kelly quickly burst my bubble and said, well, hey, they did get a benefit, but they are just sort of on a pass level now at the moment. So it did improve their quality of sleep, but they're still down on a low level. And basically the sleep of our roofing participants was not good. So that spurred us to look into this subject a little bit more and do a bit of a dive deep. So we've roped Matt Vaughan in to help us in this mission. So Kelly also suggested that she thought that there was some pathologies, some roofers that had actually sleep pathologies that needed some special attention. And she didn't doubt that and wondered what the number of roofers with sleep problems were. And these sleep pathologies, you know, you can't, no amount of chamomile tea, you can't have a big enough lavender-filled pillow to actually overcome these sleep pathologies. These are things that really need professional help. So we'd like to bring those to the surface today a bit later, and Kelly will talk about those. So regarding the evidence for all of this and injury prevention, and especially musculoskeletal injury prevention, that the evidence is really strong that sleep is a huge contributing factor to musculoskeletal injury. We've learned a lot about sleep from other industries, but we've got a lot to learn in construction. As Kelly said, there's not a lot of research, so we're making our own up and we're giving it a real New Zealand flavour. So the model you see in the slide is a proposed model of how sleep interacts with the musculoskeletal system, how it influences inflammation, how it is a mediator between our lifestyle and our physical health and our mental health. And it's a great moderator, and I don't think we'd ever sort of deny that. The evidence is really strong to say that sleep impairs our mental and physical performance. I think that's really well known and well accepted now. The research is absolutely strong to say that poor sleep results in susceptibility to illnesses. And I would probably put, you know, viral illnesses onto that, colds and flus, and just feeling run down. The evidence is strong that a lack of that sleep problems cause you to have a poor tolerance to pain. So our poor tradies, our poor roofers that Matt's working with aches and pains, if they're not sleeping well, they'll be feeling those things more acutely during the day, and they'll be causing more of a problem for them. So the wear and tear these guys are going really depends on the sleep being good. So I think it was Gandhi who said, when I go to sleep, I die, but when I awake, I am reborn. And I often wonder, did Gandhi know quite a lot of tradies? Because that's the story about tradies, really. Once you hit the hay after hard days on the tools, you rely on waking up semi-refreshed. The issue is that sleep is competing for a lot of time in a tradie's life. A tradie's life is highlighted by early starts and late finishes. 8 to 12-hour days are just the norm. 1.5 to 2 hours traveling time amongst that. And really, there's not a lot of time to do other things in life. And I think sleep is something that is often compromised. And even, the gold standard 8 hours, I'm pretty sure a lot of tradies aren't really getting anywhere near there. So we think this is a really good issue to look at as an industry. We think it's sleep problems are potentially prevalent throughout the trades, and we hope that you'll join us in actually diving into it and seeing what we can do about it and seeing how we can use it to actually reduce some of this burden of injury that we find that's upon us. So the good news is that there is some things that we can tell our tradies and our workers. There are some things that we can do as employers to start to make a difference to people's sleep hygiene and well-being. And we've got Matt on board today just for that reason. He's been working, as he said, with roofers all around New Zealand, influencing well-being really positively with some really pragmatic and simple things that you can do and you can suggest for workers. So Matt, I might just hand it over to you because you're the man on the ground about this stuff. And if you can tell us, what can we tell our workforce, and what can we do as employers in this space?
Yeah, absolutely. Thanks, Chris. Yeah, and look, yeah, I'm here to talk about sleep hygiene, but let's connect the dots a little bit closer, because my first 10 years before coming back to New Zealand was strongly based around strength conditioning and nutrition for athletes, for a lot of athletes, different sports all over, the UK and also Australia. Now, I believe that roofers and athletes are exactly the same in many ways. Just the thing is, roofers need to turn up and play the game for 8 to 12 hours, 5 to 6 days a week, whereas athletes, they have to be at their best once every maybe week for certain sports, once every 2 months for other athletic type of games and so forth as well. It's so different for them. Whereas roofers, they are under the pump all the time. So sleep is the biggest one. And I work with the top strength and conditioning coach over in Australia by the name of Alex Natera. And I'm also got a very good meeting with the Crusaders S&C coaches on Monday around this exact type of stuff as well. So that's a really good one. So sleep hygiene is all about how we look after ourselves. Basically, in short, how do we set ourselves up to have a good sleep? So that's a really, really important part of that. Can I go to the next slide, please, Stephen? So for us, it's about trying to get that bedtime consistency or that sleep-wake consistency, so we can naturally get our body clocks in order. Because Kelly's going to go into this a little bit further on. She's going to bring a real sort of doctor notes to this. But if we can get the equivalent of, like I say there, anywhere between 49 and 56 hours each week, I've just done that on 7 to 8 hours as a type of standard. Let's call that a gold standard for many cases. If we can get anywhere near that, we are going to be a whole lot better off. And there's a whole lot of things that come into play when it comes to that. So our bedtime consistency is really, really important for our immunity and our health and well-being. Next slide, please, Stephen. So for us, if one thing I've always said for many, many years, again, training athletes and so forth, is quality of sleep is about having that environment that's going to basically tell us to go to sleep. If we were to rewind the clock, I'm going to say a good 100+ years ago, we used to go to sleep when the sun went down, because that would sort of tell us to go to sleep, and we used to wake up when the sun comes up within reason. Now, because of so much fluorescent lights and false lighting, we can stay up for hours. For example, we can have one of these in our faces, or we can have one of these computers in our faces for ages, which is basically saying to us, oh, we should be awake type of thing. Optimal sleep environment is about trying to reduce direct light 2 hours before bed, i.e. dimming the lights, so it can really start to set us off to make us want to go to sleep. So that's a really good little tip for anyone that's on here who can't get away from doing the busy lifestyle type of thing. So a dark room, and I'm talking as pitch black as you can get, even if you're in shift work. If you can create a pitch black room, that'd be really, really positive for you. Next slide, please, Stephen. Now, here's an obvious one, and you'll notice that there aren't any notes with this at all. Reducing alcohol, drugs, and caffeine. Look, really, really obvious one here. People think they get to sleep better. They think that they are actually having a better quality sleep, but drugs, alcohol, caffeine, these are all types of things that are going to reduce our quality and also the way that we repair over time. And again, Dr. Kelly can dive into that for you and bring up the huge amount of studies that have that we've done on this. Well, not me, but lots of other people have done on this. So it's an absolute must for everyone. And it's harder to be said than done type of thing as well. I do understand that, because habits are the one thing that make these a real common effect for us. Next slide, please, Stephen. Now, as employers, this is one of the big things for us, okay? What can we do? Well, as I say there, what we can't do is you can't tell your adult employees to go to bed. I 100% understand that, right? Everyone's an adult. Everyone is earning their money. Everyone's got their own choices in lifestyle, right? But what we can do is set the tone with our own actions. Talk about maybe your bedtime routine, maybe how your sleep hygiene has improved because you've said that you're going to do X, Y, or Z. So make it a common practice around your business. That's a really good way to start. You can set a capacity of work hours. Now, that might be a crazy thing to say, especially if you're under the pump. But if those extra hours going from, say, 45 to 55 and then plus, you're noticing that you're getting more injuries, maybe that's a good thing to look for as well. You can start to implement some proactive programs in place. Yes, I know that's like a small plug, but if you set any program with anyone, with CHASNZ or anyone like that there, around a program that gives you some educational tools around this, face-to-face or online, it's going to, again, help with that environment or the culture around sleep and recovery for you guys. And the last thing, like I just mentioned there, you can change the culture around the importance of sleep. And this is phase one right now. Phase one is about us talking about it more, actioning some small steps more, making it the obvious thing to do. And if you don't believe we can do it, I know for a fact we can, because I remember some time ago when we stopped smoking in buildings and so forth. That seemed like it couldn't happen. It can happen. It just takes a whole team to be able to do it. And that's part of what we're on to. So I hope that helps a little bit, and it'd be great to hear from the other team now.
Right, so this is, I guess, now what we're going to kind of talk to. So Matt's touched on a few things that we can kind of do ourselves around our sleep, and what we can kind of encourage in the workplace and in our organisation. And I can't stress enough around starting the discussion around sleep and fatigue. And I kind of liken it to the progress that we've kind of seen with mental health. And the change that we've seen around the discussion. I'm hopeful that we can kind of, people can talk more about their sleep and their fatigue and their energy levels and get to it, a similar point. And we only get there by talking about it. And you guys are obviously here because you're interested in it and would like to talk more about it. So, I didn't mention at the beginning, but I also work at the Sleep Well Clinic. So I see patients every week for all sorts of sleep disorders and sleep conditions. And that's everything from commercial drivers to, just regular people that are struggling with their sleep. And so I'll talk a little bit about sleep pathologies or sleep disorders or sleep conditions, and kind of highlight, I guess, some red flags that you can kind of think about for yourself in terms of your own sleep and whether, it would be worthwhile getting things checked out. And then also, I guess, raise the discussion. Can we start to talk about some of these red flags in our own organisation? And can we, dare I say, try and, kind of capture some data so that we can understand what's going on in the construction industry, and how many people need help, and what that kind of pathway looks like, and what that process looks like. And so, yeah, so I guess, our team here is really keen to kind of have organisations that would like to start that discussion so that we can, work with you guys. So yeah, so I'll talk about that. But first of all, just would like to touch on sleep. And look, sleep, I could talk for hours about sleep. It's a very complex process. And so I'm really going to try and simplify it down a little bit, because we don't have all day to talk about it. But, why do we sleep? What's going on? So there's two processes that help us to sleep, and on the flip side, help us to feel alert and energetic and on. So the first one is the homeostatic system. And so probably have never heard of the homeostatic system, but it's a really, really simple system. Basically, the longer you're awake, the greater the sleep pressure that you build up, and the greater the drive to go to sleep. So if we kept you awake for 48 hours, your sleep pressure would be huge. We'd tuck you up into bed somewhere and you'd fall asleep just like that. Whereas if you'd only been awake for 4 hours, you haven't built up a lot of sleep pressure, it'll be harder for you to go to sleep. So really simple kind of, system to kind of get our heads around. What I would highlight particularly in this industry, and for anyone that has shift workers, think about, like Chris mentioned, if we've got a long kind of shift, so we've got people working 10, 12 hours. I work with organizations that have 14-hour shifts. So, 12 hours plus overtime. And then you think about a lengthy commute time. So you add an hour on either side. And then people have got to get up in the morning, get ready for work. And then on the flip side, shower, the sleep pressure that person is building up over those, really long kind of shifts, and the commute time, that sleep debt or that sleep pressure that they're building up really puts them at risk of something happening in the workplace or on the commute home. And so we're putting our people at risk of not getting home safely. And if we look from an injury perspective, if we look at the data that's out there, and they've done lovely studies where they've looked at injury risk for 10-hour shifts and 12-hour shifts and beyond, it's not a nice linear graph in terms of injury risk. It becomes an exponential kind of graph. So as soon as people are, working those longer shifts, their risk of injury increases. And part of this is likely to be contributed to the sleep pressure that's built up, fatigue that's built up, that's kind of tying into it. So yeah, so have a think about that. So that's that homeostatic sleep system. The other one is the circadian rhythm, or our internal body clock. Hopefully everyone's heard about our internal body clock. So we've got this clock, which is about 24 hours. It's a little bit longer than 24 hours. And in terms of sleep, it's driven by our core body temperature. So during the day, our core body temperature is high. And that helps us to feel alert and energetic. In the afternoon, we have a little dip in our core body temperature. So that's a nice time for a little siesta. And that drive to have kind of a little sleep is driven by that drop in that core body temperature. It then starts to rise again late afternoon and into the evening. And then about an hour before we go to sleep, it starts to drop again. And so a really nice way to think about that is, to get your head around with that, is if we think about hypothermia. So we think about someone being exposed to the cold. One of the first things that happens for them is they start to feel sleepy. And so not to the same degree, but a similar thing is happening at nighttime. We get a drop in our core body temperature. It helps us to feel sleepy. It continues to drop throughout the night and we sleep. And then about an hour before we wake up in the morning, it starts to rise again. And then we wake up and off we go for the day. So that, really quite simplistically, that core body temperature is driving that internal body clock for sleep. So those are, kind of the two sleep systems going on. just to kind of reiterate what Matt spoke about with that circadian rhythm and that consistency with a bedtime and a wake up time, we can really lock in that bedtime and wake up time by going to bed and getting up at roughly the same time every day. And a nice way to think about that is a walking track. So if you are going to bed some nights at 10, some nights 10:30, 11, you're creating a path in the bush that's going off in all sorts of directions. Whereas if you walk the same path every night at 10 o'clock and you create a very well-worn path, and the same with when you get up in the morning, you know, very consistent wake up time, that's locking in that circadian rhythm around sleep time and wake up time. So, you know, if you're wondering why do we do that consistency thing, it's tapping into this internal body clock and creating a very strong kind of path in terms of sleep time and wake up time. So look, that's a, you know, really quick overview in terms of those two sleep systems, but that's what's contributing to sleep time and wake up time. In terms of insomnia and other sleep conditions, we can play around with these two systems and adjust them and manipulate them to improve sleep. So yeah, that's why we sleep. So we can go to the next slide. Thanks, Steve. Right, so now I'm going to kind of shift focus into some sleep conditions or sleep pathologies. What I would say is, and I'm going to relate it back, perhaps not super eloquently, but relate it back to a construction kind of viewpoint. If we think about kind of a foundation and a house, if we can think about sleep hygiene as the house, and so we can do all of these nice things around our sleep hygiene. So in terms of, you know, not being on devices before bed and you know, watching our caffeine intake and that sort of thing. And those are certainly beneficial for our sleep and will help support us with healthy sleep. But if the foundation is broken, and the foundation in this instance is sleep disorders, if that foundation is broken, anything we kind of do that's nice around the house is really going to have minimal effect in terms of improving our sleep and improving our health and our well-being and reducing the risk of injury. So we've got to fix the foundation before we kind of pretty up the house and do those sorts of things. So yeah, so we can go to the next slide. Right, so sleep conditions. So I'm going to focus on three main ones, and if I've got time and if I haven't spoken too much, I'll talk about another one as well for us to kind of think about. But the first one I'd like to talk about is snoring. So snoring we often think of as something that's noisy, as perhaps something that means that we're dead to the world and having an amazing sleep because we're snoring our head off. But actually, I'd really like to kind of change the way that we think about snoring. So my question to you is, if you snore and if you wake up and you don't feel as refreshed or feel as good as you think you should, and you might have gone, gosh, I've got 8 hours sleep. Why do I still feel tired and not super great? What am I doing wrong? And you snore, I would like you to have a think about the fact that snoring is probably impacting the foundation of your sleep. And so, so for some people, snoring can be completely benign and really have no effect on them. But for the majority of people, snoring does impact the quality of our sleep. And we've got a fancy name for it in our clinic, or not just our clinic, but worldwide. It's called upper airway resistance syndrome, which is basically snoring plus daytime fatigue or feeling tired. And so what's happening with snoring? So we'll just have a quick wee discussion about that. So when everyone goes to sleep, and that's, you know, that's all of us here, we move from light sleep into deeper sleep and then into REM sleep. And the amount of those that we have varies from each sleep cycle. So when we go from light sleep into deeper sleep, all of the muscle tone in our body switches off. And so it does that in preparation for REM sleep, for dreaming sleep, because we don't want our muscles essentially on. We want that muscle tone off. And so a good way to think about that is if we were dreaming about skydiving, or boxing or whatever, and then we start acting that out in our dreams, you've got people jumping off the bed, you've got people boxing their part, you know, there's all sorts of things that could happen. So anyway, so the muscle tone switches off, perfectly healthy, normal part of sleep. But what that means is the muscles that are holding open our airway also switch off. And for a lot of people, that has no impact. The airway stays open. They continue, they descend down into deeper sleep and REM sleep, perfectly fine and healthy, and they have a good night's sleep. But for people that snore, what's happening is when that airway closes off, when that muscle tone switches off, that airway starts to close off, and it partially closes off and it creates a vibration. That vibration is snoring. And so what happens with that vibration is, because it's with our breathing, it sends an amber alert to our brain, and it goes, hold on, something's happening with our breathing. This is not a good thing. And this is all happening while we're asleep and we're unaware of it. And so it drags us out of that deeper sleep and into light sleep, because we want to address that breathing issue, because breathing trumps sleep. And so we then drag back into light sleep, and then the muscle tone switches back on and the brain goes, oh, fantastic, issue resolved. And so you've gone back into light sleep, but then you start to move back into deeper sleep. Muscle tone switches off, airway starts to close, causes a vibration, amber alert to the brain, hold on, wake up. And so you're dragged back into light sleep, and you're thrashing around between light sleep and deep sleep throughout, you know, kind of the whole night, never getting into these lovely, elegant sleep cycles where we get nice, good quality deep sleep and REM sleep. And so hence the waking up in the morning and not feeling entirely refreshed, because you've never, you know, kind of got sufficient kind of deep sleep and REM sleep. So I would challenge it and say, if you snore, don't think that it's something that's going to have no effect on you. And the other thing that I see a lot of patients, I would say probably a third that come to see me that snore is because their husband or wife has said, you need to go and deal with this issue because the snoring is disrupting their sleep. So, and so they're there to deal with the issue because they don't want to disrupt their partner's sleep. So, you know, lots of good reasons to look at snoring, and there's lots of treatment options around it as well. So, so yeah, so that's snoring. So first red flag. So we can go on to the next one, Steve, which is obstructive sleep apnea. So I've talked about that muscle tone switching off as part of normal healthy sleep. What happens with obstructive sleep apnea? It doesn't just partially close. Well, it does. So it partially closes and you get snoring, but actually in obstructive sleep apnea, it goes a step further and the airway actually closes off. And so, so then what happens is with that airway closing off, that sends a red alert to the brain. So it's not just an amber alert anymore, it's a red alert, because it's like, hold on, you're not breathing anymore. Your oxygen levels are dropping in your blood. You've really got to do something about this. So again, it drags that person out of a deeper sleep and into lighter sleep to deal with the drop in oxygen levels and not breathing. And so that's what's happening with obstructive sleep apnea. And so if it's happening, that airway closing off 5 to 15 times an hour, it's mild, 15 to 30 moderate, and above 30 is severe. And we sometimes see people in the clinic that's happening 100 times an hour. And so the other thing that happens with that red alert that's going on to the brain around you're not breathing anymore is it becomes a stressful event. So the body releases cortisol and adrenaline. And so not only is your sleep being disrupted, but actually sleep becomes a stressful event. And so what should be restorative and help you to feel, you know, physically and mentally restored is actually a stressful event on the body. And so and what we see is that with OSA, when it's kind of mild, moderate and above, it's actually putting cardiovascular strain on the body. So we see increased blood pressure, we see increased risk of heart attack and stroke and all sorts of things. So not only is it disruptive for sleep in the way that you feel, but it actually has medical consequences. So And look, if anyone wants to talk about OSA in more detail, because again, it's, you know, complex kind of issue, but I guess what I would say is, again, if you snore and you don't feel as refreshed as you think you should in the morning, if you have someone that you sleep with, so a bed partner, and they've ever noticed that you have pauses in your breathing, you know, so you might be listening to them snore and then all of a sudden there's silence. You know, that's that airway closing off. And then sometimes what will happen is they'll come awake with a choke or a gasp, like, because the muscle tone will switch on and they'll go and take a big breath, all unknown to the person that's, you know, kind of experiencing it, because it's happening in this light sleep. So, again, we've got tests for this, and we've got treatment options. So that's sleep apnea. This will dramatically increase the risk of injuries or accidents happening at work, dramatically increase motor vehicle accidents. If you've got commercial drivers, we've got NZTA regulations around this condition needing to be managed, because it's such a risk on the road. And likewise, you've got people operating power tools, all sorts of things, up on scaffolds, that sort of thing. If they've got these sorts of conditions, the consequences, it's not like they're driving a computer, the consequences are just huge. So yes, that's OSA. And then we can move to the next one, thanks Steve, which is insomnia. So right, so with insomnia, we've got two types of insomnia. So we've got acute insomnia. So we've all had times where we've had acute insomnia, where we might be worried about money, we might have something, a deadline coming up at work that we're a bit stressed about, or a presentation, if that kind of, you know, worries us, that sort of thing. And when the stressor goes away, the disrupted sleep resolves itself. So that's acute insomnia. So nothing to be worried about, and you know, is perfectly kind of normal for all of us at different stages. When it becomes regular, and so the definitions, if it's more than 3 nights a week for more than 3 months, it's defined as chronic insomnia. And so insomnia, we kind of, again, think of insomnia as a person being awake all night, just not sleeping. But that's very extreme. Insomnia is if it takes you a long time to fall asleep, so it's over 30 minutes, and that's happening more than 3 nights a week. Or if you wake up regularly throughout the night and then struggle to get back to sleep, so you don't kind of go back within a minute or two. So you had lots of wake ups and spending a long time awake. Or if you wake up early in the morning, say 3, 4 a.m, and you just can't get back to sleep, even though you haven't really had enough sleep. So if any of those 3 are kind of ringing bells for you, it's possibly insomnia. Really interesting study that looked at kind of long-term insomnia, and what they saw was that people at the beginning of the study, when they tracked them over the years, at 5 years, about 38% still had insomnia. So it's not something for a lot of people that just corrects itself and goes away. A lot of people need support. Again, we've got lots of treatment options for insomnia. So don't battle through it on your own and hope for the best, or think this is just my sleeping now. There's lots of treatment options, and it doesn't have to be persistent and have such an impact on your life. So, and we can learn, you know, from our workmates as well, if they're suffering from this. The thing with sleep deprivation and insomnia is, a lot of people are just putting one foot in front of the other, and sometimes they need a colleague or a friend or a partner to kind of go, hey, you know, let's get some help. So yeah, so that's insomnia. I'll just really quickly, it's 1:44, delayed sleep phase. If you've got apprentices or teenagers at home, young adults in your workforce, delayed sleep phase is when they can't get to sleep before kind of midnight, 1 a.m, 2 a.m. It's not laziness. Their whole circadian rhythm has shot out. And it's so when people become teenagers, it tends to shift out a couple of hours. For some people, I saw an individual in the clinic the other day, it had shifted out till 5 a.m. They couldn't get to sleep till 5 a.m. We can shift it back. So if you've got young tradies, apprentices in your organisation, we can help them to, you know, 10 p.m. to 6 a.m., whatever that looks like, you know, that we would like them to, you know, to kind of, you know, be sleeping. So yeah, so what can I do? You can self-refer to the Sleep Well Clinic or to other sleep clinics. If you've got Southern Cross Health Insurance, they will cover a sleep test, 80 to 100% of it. So if you've got that, make the most of it, and, you know, tap into it. You'll get an at-home sleep test and a consultation with one of our sleep doctors to look at what's going on with your sleep. Or talk to your healthcare provider if you're feeling like your sleep's rubbish. There are other things that can disrupt sleep. So vitamin D deficiency, iron deficiency can make you feel tired during the day. There's a whole bunch of reasons. So it's not just about sleep conditions. If you're feeling tired, fatigued, you know, talk to your healthcare provider. Severe sleep apnea is often covered by our public healthcare system. There's a bit of a wait time depending on what region you're in, but know that, you know, some treatment is covered. So, you know, that can be helpful for people. The big thing that Matt, Chris and I have been talking about is what can we do around perhaps a screening questionnaire, a toolbox talk to get into workplaces and talk about sleep, talk about fatigue, talk about, you know, are there people that snore? Are there people, you know, that are struggling with insomnia? And what can we do in the workplace to support them and help them? And, you know, I mean, we know that it's a broad statistic, but 30 to 50% of people snore and 57% of kind of middle-aged men snore. It's a big statistic. 7% of people have obstructive sleep apnea. And I'm sure that the actual number is much higher because so many are undiagnosed. So these aren't rare conditions that we're talking about. These are common. They'll have direct consequences on people's health and well-being. So we're open to working with organisations to support you with this. Right, I'll stop talking now.
I just want to say, Kelly, that great information. Also, directly within my life, my dad, 100%, he's a tradie, still works to this day, 75 years old, has had 2 operations for his heart stents, 100% cardiovascular issues, and definitely around poor sleep in his circumstances. And also my beautiful wife, IBS, has trouble sleeping. And I deal with people all the time with just their general health and well-being, weight management, even something as simple like that, because of sleep. So amazing information. Thank you very much.
And I'll put my hand up to say the best thing that happened to my sleep was to help my wife with her sleep apnea, because I was always worried that she wouldn't start breathing again, and I waited till she did. So thanks for that, Kelly. That's an awesome outline. So that's me again. We'll finish off with this, guys, very quickly. Kelly, Matt and I will be running a study on roofers' sleep habits in the Canterbury region. So if you're a Canterbury roofing business, we would like to hear from you if you want to be part of this study. We will be measuring and assessing how much sleep disturbance and what type of sleep disturbance is out there, how much sleep apnea is there, how much insomnia is there amongst roofers, diving into it with a toolbox from Matt and Kelly as well. So if you'd like to be part of that study, then please get in touch as per below. Thanks, guys.
Thank you so much to our panel for this very informative and interesting presentation, and I'm sure that many of us in the audience will be, thinking twice about what we say to our bed partners the following morning. So thank you so much for your time today. That concludes the presentation part of our webinar, and next we'll head into some questions and answers. Okay, so from the chat, I have a question here from Pia, and this is to the panel. Have you looked at risks caused by long shifts or other ways work is done that are fatiguing? I am very interested in the way that work is designed and its contribution to fatigue.
Yeah, so a big part of different organisations that I've worked with is around that good work design piece, and around helping organisations to change the way that they do work to help reduce shift length so that people have more opportunity to use that time for sleep and to reduce the risk of fatigue. So yeah, that's a big part of what I've kind of done, not in the construction industry, but this is more kind of other operational type organizations. Yeah.
Thanks, Kelly. Another one from Kurt. What is the ideal amount of sleep, and what is too little and what is too much?
Yeah, so kind of I liken it, I came across a great example. They call it the Goldilocks effect. So not too much, not too little. So generally 7 to 9 hours is the recommendation for adults. And you need to find that sweet spot for you. So for me, it might be, 8 hours, but for you, it might be 7 hours where you function really well. There's a very small number of people that have a genetic trait that means that they can survive on, kind of 5 or less hours of sleep. Being genetic, it runs in your family. So if you've got, a parent and siblings that also display that ability to have short sleep, but it's a very rare trait. So don't think that that you've got that. Chances are you probably don't. And if you don't have other family members that are the same. Likewise, if you find that you need to sleep kind of 9-10 hours or more, then that points or highlights to potential other sorts of things that are going on. And so we know depression, for example, either contributes to not sleeping or sleeping for really long periods. We know we often see people with obstructive sleep apnea or snoring, just, trying to sleep and sleep and sleep, but still feeling rubbish. Again, it's that foundation of that sleep. So 7 to 9 hours, but, that's a wide window. So it's really individual. And it's about being consistent. So it's not going 6 hours during the working week and then massive big sleeps on the weekend. And then my average over the week is, 7 hours. We know that shortchanging yourself and getting deprived in sleep, it can take four nights of catch-up sleep to overcome some sleep debt that you've built up. So it's not just a matter of shortchanging yourself during the week and then thinking a couple of long sleeps on the weekend and I'll be good to go the next week. It takes 4 nights or more for reaction time, coordination, health metrics to start to kind of improve. So it's really about prioritizing good quality sleep every night and figuring out that sweet spot amount for you as an individual.
Thank you. I've got another one here from Michelle. Does one need a referral from a GP for Southern Cross to cover it?
No, so sorry, and I didn't get a chance to talk about that. So basically, for the Sleep Well Clinic, for example, all we need is your Southern Cross number. And then a few other details like name and address that we send. So we send out a sleep test that you do at home. We courier it out. You do the sleep test at home, and then you send it back to us. We analyze the data, and then we do the consultation with our sleep doctors, either in person, we're all around the country, or virtually. So don't need a referral from your GP. Just need your Southern Cross number, and then we're good to go.
Thank you. And one final question, this one's from Isaac. I get plenty of sleep at night, roughly 8 hours, but still get sleepy around 1 or 2 p.m. in the afternoon. Why?
Yep, so that's that circadian. Do you remember how I talked about the body internal core body temperature? So we all get a little drop kind of that siesta time, kind of early afternoon, and it's just driven by that biology. So we all have a little dip, which means that we could have a little sleep if the opportunity kind of presented itself. In terms of naps, if you are going to do naps, 15 to 20 minutes is ideal, just so that we don't then go into deep sleep. Because if we get into deep sleep and then we wake up, we get this thing called sleep inertia, which is when we feel really groggy, and can kind of, some people that can affect them for a couple of hours. Plus also, if we remember back to that homeostatic sleep system, as soon as we go to sleep, we're paying off that debt. And so it then means when we go to sleep at nighttime, we don't have as much sleep pressure built up. So it can then mean that we don't sleep as well at nighttime. So that can be kind of the payoff as well there. So perfectly normal to have that little kind of lull early afternoon.
Thank you so much. And thank you very much to our panel, Matt, Kelly and Chris. Sorry, folks, that we couldn't answer all the questions in our chat and Q&A this time around, but we will I will get the team to respond to those when the final recording for the webinar comes out in due course. So I'd like to take this opportunity on behalf of CHASNZ, with the CHASNZ crew. Thank you so much for tuning in this Thursday afternoon. And thank you to our panelists for being marvelous presenters, and we've learned a lot today. So that's all from us, folks. Thank you so much for tuning in. Have a wonderful week, and we'll see you in our next webinar. Take care.